My name's Carol Garside. I graduated in 1983, so it's just been 40 years. I retired 2 years ago. I majority of my I did work a couple of years in Sudbury, but then the majority of my career has been at Surrey Hospitals, where I worked a variety of places. I worked pediatrics, surgical, emergency. The majority of my career was in ICU, and then I went to education, patient or nurse education, and then I went to clinical informatics is where I ended my career. So I did a lot of different things.
I'm Raina Delhenti. I graduated in 2007. After that, I worked in Sudbury briefly in peds and ICU, and then I was on medical float. Then I ended up going to Blind River for a number of years, and then most of the time was at Sioux Area Hospital, where I was in ICU and Emerge. After that, I went to home care and was briefly a care coordinator, and then a rapid response nurse helping people that were newly discharged from the hospital and transitioning them home. And most recently, I'm working as a mental health and addictions nurse in the schools.
My name is Ava Engel. I'm a first-year nursing student here at Sioux College. So I don't really have a whole lot of experience. I just graduated high school in 2023. I've grown up in the Sioux area my whole life. I went to Cora, and yeah, I'm just sort of getting started right now, but I'm really enjoying nursing so far, and I'm really excited to kind of see where these next 4 years are going to bring me.
Nice. As you can see by listening to us, there's a lot of facets to nursing.
Yeah.
You never get bored.
Yeah.
That's the best thing about nursing is that you can take it anywhere, and you can do just about anything.
Yeah, that was definitely what sort of attracted me to that career. I've grown up with nurses. I have nurses in the family, and when I was in high school sort of starting to explore different career options, I definitely looked at a lot of different areas, but I found nursing was just something that I kept coming back to because I wanted to pursue a career that sort of promotes care and where you really get to form relationships with people and really make an impact in someone's life. And then I had the opportunity through my high school to do a co-op placement at one of the local long-term care homes here. And that whole experience was really eye-opening for me, and it's actually sparked a big interest in working in gerontology. That's definitely a field that I'm interested in right now, and it lines up really well with first year because we get to continue that and that's where our first clinical placements are. So I had a really good experience there, and that's definitely a field that I'm interested in working in afterwards.
So do you see yourself graduating and then working in a hospital or long-term care setting? Or do you see yourself graduating and pursuing your education farther, or going into administration, going into...
I think right now I'm planning on graduating and working for a little bit first just to get a little bit of experience. I'm not sure exactly which setting. I'm thinking maybe the hospital setting just to start off, but obviously a lot can change in 4 years, so we'll see what happens. And then I'm definitely interested in pursuing graduate studies after that. Not sure what those will be yet. I've thought about medical school, law school, nurse practitioner, so definitely a lot of options.
Do you think your peers in high school are aware of the careers that are out there in healthcare?
I don't think so, no, and I think even myself, I'm still even learning more and more careers that I never would have imagined that you could do in healthcare or with a nursing degree. I think the options, there's so many options, and you really don't realize that a nurse can be a lot more than just at the bedside, although that is one role that a nurse can have, but you hear so often, where do you see yourself working, where are you going to be, where do you want to work? And I think that obviously you can say that you have an idea of it. Like I mentioned, I'm interested in gerontology right now, but I think it's so unpredictable. And honestly, once you start working, I think it's really easy to find yourself drawn to a different career path, or like you said, put in a different role, but you just end up loving it. And
because you have no idea until you try it. And that's
Yeah.
the biggest thing I think I'd have for new nurses is to try everything.
Yeah.
Or don't get stuck in one job. I've worked with nurses that have been doing the same thing for a million years, and they're miserable. Yeah. And I always say there are different jobs out there in nursing. Why are you staying here on something you're not enjoying when there's different things you could do? Yeah. When I decided to go into clinical informatics, I was there for, I don't know, 4 years before I retired. And I'm an old person. Computers were not my thing. And I went for the interview and I said, like, do you think I can do this job? They go, oh yeah, no problem. And I did it, but I learned a lot. Like, you can learn, I learned something every day, I swear, from every person I ever met, whether it was bad or good. You learn something every day from every person you come across. It's pretty amazing. I often found younger nurses would go to it. Yeah, they've been working for a couple of months. They'll go to someone who's been working for a year to get advice for them. Those people haven't been working long enough. Find an older person that you're comfortable with, that you know you can go to, and make a friend. Make a friend with one of the older nurses, because that'll be the best thing you'll ever do.
Yeah, that was one of my important things I was going to say, is always, ask for help when you need it. Look for help to other people that are more experienced than you. Never be afraid to ask questions, because we'd all much rather you ask questions than think that you knew everything. That's like one of the most important things. Like she said, find yourself an older nurse. There's usually, some mama bear types that take a few under their wings. Like, I remember being in ICU, we had a number of them that you were always comfortable going to ask, because they'll, while they might be quick to say if you did something wrong, they're also quick to say how to fix it and how to help it. They are very helpful and try not to be intimidating, but so there's always somebody who finds something that's helpful, or a different way of doing things. And
yeah, I've definitely noticed that, at least for me, like when I go to clinical, the attitude I like to bring is just willingness to learn, like understanding that I do have a lot to learn, obviously. Lots more years ahead of me. So I think that's really important what you were saying, especially about not being afraid to ask questions, because I think that's a big thing for students. It can be a little bit intimidating, especially it's a whole new setting, it's a whole new environment, new people, new everything. So it's very overwhelming your first time, but I think if you can find that person that you feel comfortable going to, like I had an amazing clinical instructor and I just felt so comfortable asking her questions. And even in terms of like for students, they have a mentorship program here. So I have a mentor in a 4th year who's been so helpful with me, like even just in terms of assignments, testing, things like that. Like she's there to give me advice and stuff like that. So it's definitely been helpful having those mentors and just those people to go to, just another student, but as well as like you mentioned, someone who's a little bit older, a little bit more experienced. So yeah, I've been
and people
enjoying
will
that.
notice, like if you start asking, is there something I can do for you? Is there something that I can watch? Are you doing something like that? People will remember and they'll come and find you when they have something. So if you make it known that you're looking for things, you'll find the nurses will start being like, oh, I have this going on. Let me go find Ava, see if she wants to watch. Like they'll look out for you and try to get you all those learning chances.
Build your foundation.
Yeah, like I remember I took my critical care course after I'd been working for a few years, and I was able to relate all the different case studies, like, oh, okay, I remember when I had a patient that was like this, that's why, like things like that. So you can actually, you have experience to draw back on and go, okay, that's why we did this, that's what was going on here. Yeah. So it just, you understand it a lot more. As opposed to just learning it and you've never really seen it, you're just fixing the problem where you haven't seen the whole process. But as you start getting more experience and whatnot, that you start building that confidence and trust in yourself, and trust if you don't know that you can get help from somebody else, to just kind of put off that confident air to people so that they have faith in you as well. And then I also think you have to always be a willingness to learn, because you need to constantly be updating, as you mentioned before. CPR changes every decade or so, ACLS changes, everything changes, all the different medications change. Like I look at all the
Best practice changes with, with their...
say all the diabetic meds, all the blood thinners, stuff like that over my career. Like, so you have to be able to go with that. You have to be willing to learn.
And I also don't think you don't have to be the smartest person in the class, because that smartest person in the class sometimes doesn't have the drive or they can't apply it or whatever. So you have to be able to take what you learn and then put it into practice. And I think some people struggle with that. What we talk about a lot is critical thinking. So a lot of people lack that critical thinking in life, and it's no better in nursing, right? You get you get they see what's in front of them and they do what's there, but they don't think beyond the box. So you have to really look at a whole picture. So, when you go in to see your patient, you're not just going in to give their meds, and when you're giving your bath, you're not just going in just to give a bath. You're going to do a whole assessment while you're in there. So you got to be able to multitask and that sort of thing. And she's right, communication is huge.
Yeah. No, I 100% agree. I think someone who would make a good nurse definitely has to be willing to learn. I think that's a big thing, and just understanding, like you were saying, that it's constantly evolving, and it's your ability to adapt, be flexible. I think that's really important as well, because you are working with people. Like, you can't predict anything, and
you got to be good with change.
Yeah, exactly. And your goal is you're there for them, and you have to be able to adapt and change things within your plan and things like that to really just make sure you're giving the best care to that person. And I think going along with that, obviously you have to have a little bit of that compassion too. And I think that's a big part of it, at least for me, because I like to bring that in for myself in the clinical setting, because these are people, and just you're there to comfort them as well as provide that care. And you want to I think that relational aspect is really important as well.
It's not just the patient, right? It's the families, and that's what in ICUs, it's the patient's just a small part of it. Our jobs are so much easier because you don't have the family aspect of it, because that can take up as much of your time as looking after a sick patient.
And I think that a lot of the traits that we say you have to have are not necessarily things that you go in with really strong in those areas. Like, for instance, I know when I first started, I was a little bit more shy. I'm still sensitive, but I wasn't very confident, and it's stuff that you learn. And so long as you're able to make those changes and adapt, that it's stuff that you will learn and pick up and develop along the way.
Yeah, I've already noticed a new confidence in myself, you could say, that's already starting in terms of communication, because that was something before. I was definitely a little bit more introverted. I wasn't always the one to go and start a conversation, or I would sometimes feel a little bit awkward. I didn't know what to say, sort of things like that. But I've already noticed, even my experience in the summer working in long-term care and starting as a student, that I've noticed that new confidence that's started to grow. I know it'll only continue, but just that ability to talk to people and really listen to what they're saying, and families as well, other members of the healthcare team. I think it's really important that you're able to communicate with those people and really understand and listen to what they're saying.
Got asked to be on a committee 10 years ago about all of us baby boomers are going to be retiring in 10 years, they said, and it's just right when I retired. And they're going to lose a lot of skilled staff, and what can they do about it? And one of the things I suggested was get into the high schools. They go, well, we go to the colleges and universities. I said, it's too late. By the time, for instance, once you've gone to college, you've made up your mind, and you're already on a track. I mean, sometimes you can go off, but high school is where the kids have no idea what's out there. They need to know what's in the hospitals. They need to know all that kind of stuff, which they don't know. And I see they just had 10 years later, they actually had a thing in the high school. So
I know, I was just about to mention Sioux College. They did come to my high school. They had a little booth set up, and I've even talked with actually a few of the professors, and I've mentioned to them that if they were to go back, I would love to go and talk about nursing, because I think I'm sort of in a unique position where if we were to go to some of the local schools, I know a few people, so maybe if they were to hear from a familiar voice and someone who was their peer only last year, it might
exactly closer to their age
sort of help.
And the hospital should be in there too. And there's lots of jobs that aren't even in nursing. There's lots of jobs in healthcare, period. Healthcare is where there's lots of, there's lots of jobs in healthcare, and it's not going anywhere.
Anyone considering nursing or other students, I would definitely say I've had nothing but good things to say about first year. They're definitely there to help you, and they're on your side, and they really do want you to be successful. And I also think another part that really drew me to Sioux College was that clinical aspect and being able to be placed in sort of a northern community. And I wanted to get really better insight on some of the healthcare needs within my own community, because this is where I see myself working. And having that opportunity to do that clinical placement early on in first semester was amazing, and like I said before, it was a really, really good experience. So I have nothing but good things to say about Sault College. I'm having a really good time.